Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with us.
Hello, ladies and gentlemen. Once again, it's my pleasure to welcome you to the online pregnancy school. I hope you are doing well and also observing all the safety protocols. Please stay safe. Well, just to remind you that this is the online pregnancy school. We want to say a very big thank you to those who have sent us questions and comments, liked our page, and also encouraged us to continue. Thank you very much. Then for those who have not yet done that, I want to invite you specifically to hit that subscribe button. Turn on the notification bell so that you don't miss any of the interesting and educative sessions that we bring your way. On Facebook, follow us, The Pregnancy School. Like our page, share, give us thumbs up, and let us continue on this journey of helping to reduce preventable maternal and newborn deaths. Today, I'm going to share with you a very important topic that every pregnant woman must know about. And even for those who are not yet pregnant, you must know about it, because if you know, you can take action and you have better pregnancy outcome. But before I do that, just to remind you that we have put together this wonderful magazine called Promise from the Womb that talks about pregnancy from day one, how this pregnancy grows, what happens to the baby inside the womb, up till the time that the baby is born. We also give tips on what you can do to stay healthy. And for the father, we encourage you to also read it because we have tips for you. So click on that link that we have shared down there and please get yourself a copy. Get a copy for somebody else and let's all together help to make pregnancy a time of joy and not of fear or anxiety. This is the online pregnancy school. Today, we are going to talk about a very important topic, as I said, and it is diabetes in pregnancy. We're going to share with you what it is all about and what we can do to ensure that we stay safe during pregnancy, even though we might have diabetes. So this will be the outline of the presentation. I'll take you through some characteristics of diabetes in pregnancy, and then signs and symptoms. We'll look at how diabetes is diagnosed, what can be done in the form of prevention. We look at some of the complications that can occur, the treatment that is available, and of course, we'll conclude with what we can do. So diabetes is a chronic metabolic disease, which means that it is not a disease that comes today, you treat it and it's gone. Although it can be managed such that you can stay as healthy as possible. And it is characterized by high blood sugar level. So the sugar that is moving in your blood is high. The level is high compared to the normal that should be in anybody. And we have two types, type 1 and type 2. The type 1 usually occurs in children. And in this, we have an organ in our bodies called the pancreas, which produces insulin for the body, not functioning so well. So the pancreas produces little or no insulin at all. So this person with type 1 diabetes has very little or no insulin. And that means that it makes the blood sugar stay high. Now, the second one is type 2, which is the adult onset. And that one, as the name shows, it usually happens in an adult. Globally, that's around the world. There are so many people, about 422 million people live with diabetes around the world, and it is found everywhere. The numbers, unfortunately, keep rising. Day in, day out, we have more and more people diagnosed with diabetes, and the numbers keep rising, also in pregnancy. Now, what are some of the signs and symptoms? One of them is excessive thirst. You find that somebody who develops diabetes has this excessive thirst, always feeling thirsty, always wanting to drink water. Sometimes the throat feels so dry that they have to drink water. Even when they are asleep, they have to wake up to drink water. Throughout the day, they feel very, very thirsty. And therefore, they drink a lot of water, leading to a lot of urination. And for those who probably urinate in a place that it's not well flushed out, you can see that ants may even come there around wherever that person urinated. This person may also be losing weight. So you can have somebody who will go to the hospital to say that I eat all right, but I'm losing weight. So that will be a reason why the person will go to the hospital and this person will be examined and lab tests will be done to make that diagnosis. And so this can happen in a male as well. Now, we can also have somebody going because of kidney or heart problem, and out of that, through the examination, through the history, through everything, this diagnosis is made that it's not just about the kidney or the heart, but you also have diabetes. For some of them, they sweat a lot. Others are big. We say that some people are small because they keep losing weight, but there are others who are also big. And some people feel very tired, what we call fatigue, unable to do anything. Their energy level is low. They want to sit, they want to sleep. They don't have that energy to do a lot of things. For some of them, this is what will take them to the hospital for a diagnosis to be made. And then others is because they have poor vision. They realize that gradually they cannot see like they used to see. So this is what will take them to the hospital. And then the diagnosis is made. For others, it's because they have ulcers or sores on the leg, which doesn't heal. And they go to the hospital, tests are done, and it is found that they have diabetes. For others, it may be because they have boils coming frequently. This boil will come, that one will come throughout the body. So they go to the hospital because of that. An examination is done, and this is found. What are some of the causes of diabetes, especially in the pregnant woman? During pregnancy, you find that a lot of hormonal changes take place. The hormones are in different types. So this one goes up, that one comes down, this one is at this level. Different hormones take place. And so during pregnancy, with all these hormonal changes, that is a key player for somebody developing diabetes during pregnancy. The other one is that somebody may become very big. In our previous sessions, we have spoken about the weight that a pregnant woman must gain throughout her pregnancy. So for some of them, they gain so much weight. So even though they may not have had diabetes before pregnancy, they develop diabetes during the pregnancy, and this is referred to as gestational diabetes. And with the pregnancy, the hormones and everything, there's also a disturbance in the secretion or functioning of insulin. I told you a few minutes ago that insulin is what regulates the blood sugar. It's produced in the pancreas. And during pregnancy, there could be some issues with the secretion or the functioning, and this can lead to diabetes. Now, another thing is that research have found that those who develop diabetes when they are pregnant are usually above 30 years. Please, it doesn't mean that everybody who is above 30 years and is pregnant will develop this. No. Research looks at which group of people are usually affected. And this is one of the findings, that is usually in those who are 30 years and above. And then if you have a family history of diabetes, for example, your mother, your sister, your auntie, if you have that kind of history, then the chances are that you would also have it. So please, if you go to the hospital as a pregnant woman and you are being interviewed about your history, the family history, if you know that there's somebody in your family who has diabetes, please don't hide it. Share that with the health worker, the doctor or the midwife, so that they keep track of it and know what to do for you. There's also the issue of what we call the history of polycystic ovary syndrome or ovarian syndrome. And this one, as the name says, it is to do with the ovary, where we have multiple cysts. Cyst is a sac filled with water. So we have fluid in some cyst over there. And this can also predispose somebody to developing diabetes during pregnancy. Ladies and gentlemen, if you have just joined us, today I am talking about diabetes in pregnancy, a very important topic for pregnancy outcome. If you have not yet done that, please go ahead and hit that subscribe button, turn on the notification bell, and also on Facebook, like our page, follow us, and share with friends and family. So how is diabetes diagnosed? When you go to the hospital, even if you are not pregnant, but you have some of the symptoms that we have shared, a history will be taken. A history means that they will ask you some questions about yourself now, some past history, whether you have had this condition before or that condition before. So the history is taken. And so please, if you're a pregnant woman, we go to the hospital, the midwife is asking you questions, the doctor is asking you questions. Know that they are trying to put everything together to make a diagnosis. So the history is taken. Another thing that is done is that a blood test to check the sugar level is conducted. Now, if it is found that it is high, they will do it again. So depending on the time that you go to the hospital, you may have eaten or not eaten. Ladies and gentlemen, a diagnosis is made based on certain parameters. So when you go to the hospital, they will take a history. So if you go and the midwife is asking you questions or the doctor is asking you questions, please have the patients answer all those questions and answer them as best as you can. If you have anybody in your family that has diabetes, please share it with the doctors, share it with the midwives. It's very important. Now, for those who have been to the antenatal, you know that blood tests are usually conducted. And this is to test to see whether you have anything in the blood, including the level of the glucose or sugar. And this test can be done either before or after you have eaten. It depends on what they are looking for. It depends on when it is being done. I know that for a lot of people who have done this test, you are told not to eat before you come, so that they know exactly what the level is even before you have eaten to help to make a diagnosis. Now, if the test is done, whether before or after you have eaten, and it's found that the glucose levels are high, then they would repeat the test and do other tests to help to make a diagnosis that this person has diabetes or not. Now, if this is such a disease that we need to be careful about, are there any ways we can prevent them, especially for pregnant women? Yes, there are. And it should start even before you get pregnant. And previously, I have shared with you that if you are planning on becoming pregnant, it's important that you have a medical check done. It's also important that you manage your weight. So weight management before pregnancy is important. I told you a few minutes ago that for those who are big, that is a predisposing factor. So it's important to manage your weight. And during pregnancy, anytime you go to the hospital, your weight will be checked because you are supposed to gain a certain amount of weight. If you are gaining too much or too little, you'll be told. And both instances have effect on the pregnancy. So your weight is managed very well. And then you are also asked to do some exercises. And please, the exercises, don't go and be lifting things that you cannot lift, especially if you are pregnant. Please seek medical advice. You have to seek medical advice to be sure that the exercises you are undertaking are good for you. One of the easiest you can do is walking. If you cannot go out of your room, you can walk inside your room. So try and take some steps every day. I know that sometimes pregnancy can make us feel like, oh, I don't want to do anything. But for the sake of yourself and for the baby, please do some exercises by walking, just walking. But if it's possible to go outside of your room, you can do that. You take a walk when the sun is not so high so that you can have some sunshine, breathe in some fresh air, go out, come back home refreshed. So it's very important. Now for the prevention, every pregnant woman has their blood sugar checked by the 28th week. She would have had this done so that a diagnosis is made whether she has diabetes or she does not. Now, it's important to note that some people may not experience any symptom at all. So they will really be surprised that they go to the hospital and they are told that, Madam, you have diabetes. I never felt anything. I haven't been very, very thirsty. I'm just as normal as possible. But remember, I told you about the hormones. So something like this should not surprise you. It should rather make you happy that it's been found and something can be done about it. Now, to prevent complications, regular testing is done to make sure that the sugar level is not going way too high or even too low, because it's also good that it goes too low. There's a level that it must stay. So regular testing is done to prevent the woman and her baby from developing complications. And then, of course, diet is also very important. And this one, I would encourage pregnant women, please do not force yourself to diet, because you need a lot of things for you to stay healthy and also feed the baby. So it's very important that if you were to go on a diet, you consult a dietitian, or when you go for the antenatal clinic, talk to the midwives, let them help you to know what you have to eat so that you don't become anemic from not eating well, or you don't overeat and also you become too big. So this is showing you some of the things that we can do. And like I've said, if you are given the supplements, we know that even before you become pregnant, you may be taking some folic acid. You also visit the doctor, you quit smoking and drinking, and you eat this healthy diet, which you can get support from your midwife to help you get the nutrition officer to tell you what you should be doing. And you continue exercising as well. It is very important that we keep healthy even before we become pregnant. Now, this is to show you that when a woman becomes pregnant, she makes a lot of hormones, as I said earlier, and then she may have this high blood sugar, which is the diabetes we are talking about. And if she did not have any diabetes before, then it's called the gestational diabetes. And I said earlier also that some of the hormones that she produces affect the pancreas, which leads to poor formation of whatever needs to be formed. And therefore, it produces less effective insulin, which will affect the blood sugar and make it high. And this woman now develops diabetes in pregnancy. So the hormones alone can affect the level of blood sugar in this woman, which is one of the key things we need to be aware of. Now, this one is showing us what happens. So the gestational diabetes, of course, it's a diabetes that occurs in pregnancy. And because when the woman eats, the food is converted into the glucose, which enters into her circulation. It also goes through the body. Now, the high level, because of the poor function of the insulin in the mother's blood, will enter the baby. We know about the placenta. That is what links the baby to the mother. And that is what takes food to the baby. So you find that this high sugar will pass through the placenta to the baby. And this baby, unfortunately, will not be able to handle this high sugar so well. And because the baby is now getting more and more and is not doing much exercise over there, the baby moves up and down, but the amount of sugar that is going to the baby is far more than what the baby needs to grow. So you find that it's not just the mother who is affected, but the baby can also be affected by the high level of glucose inside the mother. Having known all that, what are some of the complications that can happen if a woman is pregnant and she develops diabetes? We have what will happen to the mother, the baby inside the mother's womb, that's the fetus, and then after the baby is born. So for the mother, she will be prone to what we call the preeclampsia. And we have spoken about hypertension in pregnancy. And this is one of the things that can happen. She may have infections and then also cuts because of the baby's size. I will show you, because of the baby's size, when she's delivering by herself, she can have big tests because the baby is too big. And because of the size of the baby, again, this woman may be taken through cesarean section delivery because it will be very difficult for her to deliver by herself. And then she also has long-term effects after the pregnancy has ended. Some of them recover from the diabetes after they have delivered, but others, they may go on to have the diabetes. And this would go with all the other things that can happen because she has diabetes, even after the baby has been born. Now, for the baby, this child may have growth abnormalities, which means that the baby will not grow normally. There will be some abnormal features with this baby. And the water inside the mother's womb, which the baby is lying in, can also become a lot, what we call the polyhydramnios. Very big. Big baby. The tummy of this mother is very big. There's a lot of water that the baby is lying in. And diabetes is one of the causes of miscarriages. We spoke about miscarriages not long ago. So this can be a cause for miscarriage. It can also be a cause for stillbirth. The baby can be born dead. And the pregnancy may even end earlier than the term. So it can be a preterm birth. So a lot can happen to the mother and also to the baby. Now, when the baby is born outside of the mother's womb now, a lot can also happen. This baby, because of the size, and if this mother, unfortunately, is not able to get to the hospital early, or she gets into labor at a place where cesarean section cannot be performed, and she's delivering by herself, the baby can suffer injuries. The baby is big, so trying to come out will be a problem. The nerves can be affected. So you see that this baby can come out with injuries which may be visible or not visible, but the baby can be affected. The baby would also come out with very low blood sugar because of the fact that the child was in the mother's womb and was having so much. Now, when this baby is born, immediately, if this is not known, the baby can have very low blood sugar level, and that is also not good for this baby's brain. And the child can have seizures, can start fainting because of all this, and all other things. So many other things can happen. Then we have what we call the respiratory distress. Because this baby is so big and delivery probably was delayed because of the fact that it's big, the mother cannot push. The midwife is trying to deliver this baby. This baby can come out really tired, and that can affect the oxygen supply to the baby as well as the breathing. So this baby would have this problem, breathing and getting enough oxygen into himself or herself. And this means that the chances of this child being admitted at the intensive care unit is high. So that can also happen. So these are some of the complications that can happen to the mother. The baby whilst is still in the mother's womb, and then after this child has been born. So this is a child born to a mother with diabetes, and we call it macrosomia. You can see how big this child is looking more like a child who is some months old, but a newborn baby can look like this if the mother has diabetes. And that means you can imagine if this child is coming out through vaginal delivery, you can imagine how the mother would struggle to deliver this baby. And also the midwives who will be conducting the delivery would be suffering to deliver this baby. Now, having known all that, Is there any treatment? Ladies and gentlemen, today we are talking about diabetes in pregnancy. And if you have just joined us, please hit that subscribe button if you have not yet done that, and also turn on the notification bell. On Facebook, follow us, The Pregnancy School. Like our page, share with friends and family. And if you have any questions, please send us by WhatsApp or comment, and we'll be happy to answer them for you. Now, so for treatment, early diagnosis is important. With all the complications that we have seen, if the diagnosis is made early, then the treatment can start early and the effects will be minimized. So it's very important to have early diagnosis. So please, if you are there and you have any of the symptoms that we mentioned, you feel very thirsty, you drink water a lot, you see that you urinate a lot. When you go to sleep, you wake up about 4 times, 5 times, and each urine is a lot. Please don't stay at home. Or if you feel so tired, anything, whether you are pregnant or not pregnant, please go to the hospital and check whether this could be diabetes. Then the treatment would start early. The treatment also involves modifying lifestyle. You avoid alcohol. You also avoid smoking. We have said in our previous sessions about what happens to the baby when the mother drinks or smokes. So if you are pregnant, please avoid alcohol and avoid smoking, even passive smoking, where you are not the one smoking, somebody is smoking, but you are around that person. All the smoke affects the child who is inside your womb. And if you drink alcohol, it is just like the baby drinking. So many things can happen. And so if you are adding this to the high blood sugar, then it is not good at all for this baby. Again, we recommend that you do regular exercises. And please, once again, do not do anything which will be harmful to you, especially if you are not the type who was exercising previously. I'm sure you have seen some athletes who do a lot of exercises. And even when they were pregnant, they were doing that. That is different. But if you are going to do exercises, please make sure that you know what you are doing. And the best of it, if you cannot do anything at all, just walk. Take some walks inside your house, outside. Do that and it will be good. And then the treatment also involves nutritious, balanced diet. As I said earlier, do not on your own try to lose weight or say that I am dieting. And if you are pregnant, it is very important that you don't take that time to decide that I'm going to diet to lose weight. No, your midwife will advise you, your doctor will advise you so that you do the proper thing. I told you earlier that for some people, it is when they go to the hospital because they have a kidney problem or a heart problem that the diagnosis is made. So people will be screened for heart and kidney problems so that if they are found, then it is easier to know that this person has diabetes or not, and the treatment will start early. I also mentioned that for some people, it's because they cannot see well. That is why they go to the hospital and a diagnosis is made. So the eye will be checked because diabetes can also affect the vision. So the eye is checked to avoid blindness. It will be very unfortunate for you to have diabetes and also be blind when this could have been prevented. And I mentioned about the ulcers on the leg, the sores. That is also a very important thing that is managed. So that leg ulcer will be treated because there are so many diabetics who had ulcers on the leg. And unfortunately, because of nerve issues and the rest, they did not even feel that something was happening and all that. And it got to a point where the leg had to be amputated. That can be prevented. So if treatment is initiated early, then some of these can be prevented. And when all these are done, again, medications are given. If you are given some medicines to take for diabetes, whether you are pregnant or not pregnant, it's important that you take it according to the regime that has been given to you, because it's important the sugar level stays at a certain level, not too high, also not too low. So it's very, very important that as you are asked to modify your lifestyle and eat and do the exercises, if you are given tablets or you are given insulin, you go along with it and do it as has been prescribed. Now, for the pregnant women, we recommend that you have an individual care plan for yourself. One of them is to monitor your blood sugar level at regular intervals. And this one, your midwife can help you to do that. So if you're at home, you're a pregnant woman, you've been diagnosed with diabetes, it is not the end of the world. So whilst you are at home, you can have your chart and you check, you record, so you know how the blood sugar is moving, whether it's within the normal range, it is too low or too high. And if you find that you have high levels or even very low levels, report immediately to avoid some of the complications that we have mentioned. And once again, we cannot say this enough. Engage in regular but simple exercises. So for yourself as an individual, this one is your own care plan. As the doctors and midwives are helping you at home, you can also do something for yourself. And this is what we are talking about now, that you do simple exercises, because these exercises will give you some energy. They will help to burn some of the sugar. And then it will also relieve some common symptoms during pregnancy, like the low back pain, the constipations, the swelling of the legs, etc. And then you also monitor how the baby is growing. Please, when you go to the hospital with your antenatal card, they put down the number of weeks that the pregnancy is. And as you go along, they record. Then you can also see that your tummy is growing bigger and bigger. If you find you are at home, you are checking yourself, doing your own individual care plan, and you find that the abdomen or your tummy is not growing like you expect, maybe you are 6 months, but the tummy is not looking like a 6 month, don't stay at home. And if you have any other reason that you are worried about your baby, like you don't feel the baby moving, also do not stay at home. I've told you that diabetes can be a source of child deaths, even when the baby is inside the mother's womb. And so please, as you do your own plan, consider the baby. How is the baby doing? How is the baby moving? And if you find that there's anything that is not normal, go to the hospital. I just brought this to show you that there's so much that we can eat. We don't have to focus on just one food. There is so much. Depending on where you are, you may have a whole lot of vegetables. And so it is important that as you go for the antenatal, you discuss with the midwife so that you'll be directed to know which of the food available in your area you can eat. And I'm sure we have the nutrition officers who can also help you. But there are things that are common everywhere. Onions are common, tomatoes are common, some of the things are common. But it's the way you put them together. And it's very important that you get tips from the hospital. So for the nutrition, which is a key thing, please, it's important to eat protein with your meals. Enjoy daily fresh fruits and vegetables. Wherever we are, there is one kind of fruit or the other. There's one kind of vegetable or the other. So we can have a mixture. And this one, it said that when you are eating, let your plate be colorful. So you don't just have one thing on the plate. And that's why you can do this by seeking expert advice from the nutritionist or from the midwife, wherever you go, or from the doctor who can help you. And as much as you can, as much as possible, please stay away from processed and already packaged foods. You may not know what is in there that can harm you. I know that pregnancy can let women feel like eating certain foods. That is there, but that's why I say that as much as you can, as much as possible. Don't let this be the daily food that you eat, processed foods. No. Look around you. Use the vegetables. Mix them up. Do it in such a way that it looks nice. Once it looks nice, let it taste good and enjoy that. And please minimize sugary foods as much as possible. Remember, we are not drinking alcohol. we are not smoking, and we are minimizing the sugary foods as well. And this is what you can do for yourself. So you can have your plan. All these are part of the individual plan. So you can have a plan, you have your meal based on what you have available. The fruits that are available, the vegetables that are available, the protein sources that you have, the carbohydrates that you have, anything that you have available. You can plan your own meal that for breakfast, I'm going to eat this for today. For lunch, I'm going to eat this, and I'm going to eat this for dinner. This is just to guide you and help you so that you mix your food. So you don't eat the same thing unless you are pregnant and that is the only food you feel like eating every day, even if that is the issue. Please, because we have to eat different things to keep us healthy, I would suggest to you that you have a plan. If you don't write it, that is fine, but at least have a plan that I'm going to vary my food. It could be the same porridge, but then today I'm adding this, tomorrow I add that. Today I'm eating fish, tomorrow I'll eat egg, things like that. So you mix them up and you have a good meal plan for yourself. This is for those who have gone to the hospital, they've been diagnosed with diabetes, and they've been told that they have to eat this way or that way. But it can also be used by somebody who is pregnant, doesn't have any diabetes. You can still plan your meal so that you have a good meal every time to help you to build your immunity and to help you get enough blood. Ladies and gentlemen, today I'm talking about diabetes in pregnancy. And we have looked at what causes it. Why is it that some women have diabetes when they are pregnant? What are some of the complications that can happen to the mother, the baby inside the mother's womb, and after the baby has been born? And now we are looking at putting all together. So how to deal with gestational diabetes during pregnancy. These are all some of the things that can be done. So you monitor the blood sugar level, make sure that it is monitored all the time. You eat the right kind of carbohydrates. The food must be full, it must be complete. And you'll be told that you need carbohydrates, you need the protein, you need the vegetable, you need all that to be together. So have a colorful meal as much as possible. And breakfast is very important. Do not miss breakfast, especially if you are pregnant, especially if you have the diabetes and you are on medication. You have to make sure that your sugar level stays where it should be. So don't miss your foods. Eat a healthy breakfast. And if you use the meal plan, like I showed you, you can say that today I'm eating bread and whatever. Tomorrow I'm going to eat donuts and something. So you can have a mixture, something that will let you look forward to having the food every day. And if you are pregnant, the early stages of pregnancy where you are vomiting and all that, we have had a session on that already. But one of the things you can do is to have that biscuit by your side, which is not sweet. It doesn't have any, it's almost bland. So when you wake up in the morning, before you get out of your bed, you put some in your mouth, and that will help you. Somebody called and asked what she should do because she was vomiting so much. And also make sure that you continue to drink water, sips of water, so that as you vomit, you do not become dehydrated. So now, if you are doing that, you are doing here, they are recommending cinnamon tea, but you can drink other things, except that please minimize caffeine drinks. So you minimize that one. And of course, because you have this high sugar level in your blood, where the insulin is not working so well, it's advisable that you eat, when you eat the carbohydrates and the rest, if it is possible, you can do without the sugar. That would be very helpful. And then you take a good rest. Sleep is very important. It helps the body to recover. It helps us to stay healthy. So even if you are not feeling sleepy, you try to get to bed so that you can have a good night's sleep, a long one. And in the afternoon, if you are not doing anything, you can just lie down, take some rest. And please remember, we have said in our previous sessions that when you are lying, once your tummy has grown a bit, try to lie on the left. It's very important. Don't lie on your tummy. Don't lie on the back. Lie on your left to help with the circulation and the rest. It is very, very important. And of course, if you have been given any medications to take, please take them as prescribed. It is very important that you take them as prescribed. Today, we were talking about diabetes in pregnancy. And I have taken you through what it is, what happens, and what can happen to the mother, the baby inside the mother's womb, even after. I hope you have learned something new. Please remember, if you have not yet done that, go ahead and hit that subscribe button, turn on the notification bell so that anytime we have a program coming up, you'll be informed. You'll be the first to know and you'll join us. Again, Promise from the Womb. This is the magazine that tells you about how pregnancy grows from month to month, as well as tips for the mother, tips for the father, and even after the baby is born, what is there to do? All that are in that magazine, and it's on Amazon. So please look for it. Promise from the Womb by Linda Amaka Ivanhutu. Get yourself a copy. Get a copy for that lady. Get a copy for a friend, and let them all learn more about pregnancy and stay healthy so that pregnancy becomes a time of joy and not of fear or anxiety. If you have any question on today's program or previous programs, or you have any suggestion, any comment, of course, comments that will help the program to move forward, please send us a message on +233 59 242 0625. Send me a WhatsApp message. Please, WhatsApp message +233 59 242 0625. You can also share your comments with us in the comment section. But if you haven't subscribed, please go ahead, hit that subscribe button, turn on the notification bell. See you in my next video. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.